Tom. Hiya.
Who's Dr. Tom?
He's my chiropractor.
Hey, Kathy, how are you?
What's up, interns? Dr. Chris here. Over the years, I've critiqued chiropractic methods in my videos, questioning their efficacy and safety. But I've always wanted to take the time to better understand them. So today, we're going to explore the infamous spinal adjustment, or as my chiropractic friend Aaron Cabal calls them, the cracky backy.
What's the worst that can happen? I feel like if he has his license, he has to be decent, right? They won't just give out licenses to anybody.
Is there a doctor around I could talk to?
Yeah, of course. Chiropractic helps with asthma, allergies, you name it.
Did you just say that it helps with high blood pressure?
Yeah, it can. No matter what goes inside the body, it has the potential to make it better. How it makes it better, I can't tell you.
Most chiropractic patients go into the office, get cracked, and leave happy, only to have to return every few weeks to get cracked again. But what's really going on physiologically, and why do you feel better afterwards? To what extent is it actually helping you heal? Or is it just a scam, the therapeutic embodiment of a magic pill, temporary relief? Believe me, as a surgeon, I believe that surgery is a last resort.
Cut my life into pieces.
Let me repeat.
This is my last resort.
Most people don't need it and can solve their musculoskeletal or related issues by other means. Listen, I'm all for my patients trying out alternative forms of treatment before surgery, given that the treatment is actually assisting you on your road to recovery. But I also think that it is important to make a distinction between treatments that, like a Band-Aid, temporarily mask your symptoms and those that actually correct the pathology that causes your pain in the first place. Today, we'll take a close look into spinal manual therapy, or SMT, to inform patients and empower them to be able to determine themselves the effectiveness of treatment so that they can ultimately take their healing into their own hands. Because that's the goal, to have you healthy, not constantly needing healing from a medical professional, surgeon, or otherwise.
Do you know how chiropractors were invented? No. You ready for this?
Chiropractic care has deep holistic and somewhat mystical origins. Historically, it began in the late 19th century with Daniel David Palmer, initially a magnetic healer, credited for performing the first chiropractic adjustment in 1895 in Davenport, Iowa, USA. According to Brian J. Gleberson's medical textbook, Introduction to the Health Workforce in Canada, Palmer revolutionized healing arts, promoting his new method as a science of healing without drugs. Central to Palmer's approach was a belief that misalignments or subluxations of the spine could disrupt nervous system function and overall health.
Can you fix a subluxation?
He advocated for manually adjusting these misalignments to restore and maintain innate health, a concept central to chiropractic theory.
The chiropractor finds the bad area, then gently adjusts it, and that's it.
His son, B.J. Palmer, further developed this theory, introducing the tonal method, emphasizing innate intelligence as a vitalistic force governing health and healing. This method focused on detecting and correcting subluxations to restore the flow of innate intelligence, or tone, likened to tuning a guitar string to function properly.
SUBLUXATION.
From its inception, chiropractic care has maintained the belief that many ailments beyond musculoskeletal issues stem from spinal misalignments, which, when corrected, restore health. D.D. Palmer's philosophy is encapsulated in his three main points, known as the Palmer postulates. 1. There is a fundamental relationship between the spine and health mediated through the nervous system. 2. Subluxations can degrade health. And 3. Correction of spinal disorders through adjustment may restore health. The work of both of these men marked the beginning of chiropractic as a distinct healthcare profession, emphasizing manual therapy, particularly spinal adjustments for treating various ailments. However, this idea has become a rigid belief rather than something tested through research. This dogmatic stance can hold back progress in chiropractic care, make it seem less credible to scientists, and confuse the public. This is particularly concerning since Palmer came to these postulates without any formal medical training or training in anatomy.
The origin of chiropractic medicine came from a fucking bullshit artist.
Over the next century, chiropractic care has evolved while preserving its holistic roots. In 1999, Ian Coulter, a sociologist and former president of CMCC, or the Canadian Memorial Chiropractic College, proposed that chiropractors adhere to 6 common tenets: conservatism, naturalism, holism, rationalism, humanism, and vitalism, and 4 general principles, which remain unchanged. Paraphrased, they are: 1. Health is more than just not being sick. It's a natural state where the body heals and adapts. 2. Health involves biological, psychological, social, and spiritual factors. 3. Optimal health is personal and reaching one's full potential. Individuals are responsible for their health, with doctors providing guidance and education. And finally, 4. The musculoskeletal system is crucial for good health.
Chiropractors were invented in the 1800s by a magnetic healer.
With advancements in science, technology, and accessibility of information, many modern chiropractors are shifting towards an evidence-based approach.
During a seance,
Equally emphasizing 3 pillars: best available research evidence, 2. clinical expertise, and 3. patient values. However, internal conflicts still persist within the chiropractic community because of the ongoing tension between its traditional vitalistic roots and the modern scientific scrutiny questioning the validity of these concepts. As stated in the 2024 paper, A New Role for Spinal Manual Therapy and for Chiropractic, the profession's reluctance to move away from these outdated doctrines hinders its professional development and acceptance within broader healthcare systems. Moving forward requires reconciling these beliefs with contemporary healthcare standards and evidence-based practices to ensure chiropractic's relevance and sustainability in modern healthcare. In other words, if you want to play with the big boys, you got to behave like the big boys.
Take a deep breath in and deep breath.
Understanding the history helps us grasp why spinal manipulated therapy is so integral to the chiropractic identity, both amongst those in the profession and the general public. The traditional cure-all spinal adjustment is still heavily promoted for its supposed vast benefits, making it challenging for chiropractors to modernize their approaches. The paper I just mentioned suggests that this reliance on and excessive use of spinal adjustments has led to neglecting other potentially beneficial healing methods.
There are certain chiropractors that maybe stay in the lane of more physical therapy. There's a little bit of data to suggest that for certain types of low back pain, chiropractic adjustment can offer temporary relief.
Chiropractic care is the most common alternative treatment, and lower back pain being the most common issue treated.
But it's not fixing a musculoskeletal problem,
with neck pain and headaches coming in closely behind it. However, research suggests that spinal manipulative therapy by itself typically does not result in long-term solutions for musculoskeletal problems such as low back pain, highlighting a tendency among chiropractors to overstate their capacity to permanently alleviate these conditions. Again, chiropractic treatment can be helpful when used in combination with interventions such as exercise, massage, and activity modification. But it's important that you get a chiropractor that understands that, like David Oliver.
The adjustment is not the be-all end-all in my opinion. It's just one of the tools in my bag.
Now, chiropractic care is not solely focused on the SMT, though that is what we will be focusing on today. In order to understand it, we must first have a general understanding of the spine. The spine, or spinal column, is literally the backbone of the body. It holds you up.
You raise me up.
It is composed of bones, or vertebrae, stacked on top of each other. The vertebrae are then connected by joints. Neurosurgeon Dr. R. Dekmejian at the DEC Institute explains.
All of your body's extremities and organs are attached to the spine, and they put weight down on the spine.
He continues by explaining that gravity exerts downward force on the limbs and joints, being strong yet flexible, support this weight as the vertebrae compresses upon them.
Okay, so you just woke up with a little bit of a stiff neck. I call this a cervical slinger. Take a nice big breath in and hold on to that vertebral column.
Joints are composed of smooth cartilage, lubricating fluid, supportive ligaments, and a protective capsule that all work together to allow smooth movement. There are 2 types of joints at each intersection.
Where the vertebrae connect to each other, there's joints. top and bottom.
The disc joint, which is this cushion between the bones. The second type of joint is the facet joint. There's a left and a right facet joint for every disc.
Facet joints facilitate spinal movement and stability. They are located at the back of each vertebrae, connecting each one to the next. They guide and restrict movement, allowing for bending and twisting motions. Intervertebral discs sit in between each vertebrae. They act as shock absorbers, cushioning the vertebrae and providing flexibility and support to the spine. They consist of a tough outer layer, or the annulus fibrosus, surrounding a gel-like inner core, the nucleus pulposus, that moves within the disc with changes in posture. So these are the two types of joints, and joints are where the action actually happens.
For movement to happen in the spine, it happens not where the bones are, but between the bones at the disc or the facet joint.
So while the traditional chiropractic understanding often suggests that spinal misalignments or subluxations are due to bones being shifted out of place, in most cases this is not what's actually happening.
It's a misalignment. So they're dealing with a vertebrae that's actually rotated out of position. That's not what's happening. If you had that problem, you wouldn't be walking in my office.
And the misunderstanding is that chiropractors somehow take bones that are out of place and they put them back into proper alignment.
Chiropractor Jeffrey S. O'Glynn goes on to say that there is no evidence to support that. These misalignments are not necessarily caused by bones being completely out of place, but rather involve more subtle biomechanical or functional issues within the spine, typically attributed to irritation or dysfunction of the joint. This can involve issues such as restricted movement, altered biomechanics, muscle tightness, or inflammation affecting the joint and surrounding structures and nerve compression. Therefore, chiropractors will typically be looking for joint restriction.
If I feel that one of these vertebrae don't move the right way, I don't like that, because either it's going to bother that area or it's going to affect something that's connected.
Restricted mobility can result from factors like poor posture, aging, or conditions such as osteoporosis. This restriction can lead to increased compression or irritation within the spine, potentially causing various issues depending on the affected area. The spine is divided into four main parts. The cervical spine or neck supports the head and allows for a wide range of motion, including bending forward, backward, and rotating the head or bending side to side. The thoracic spine, or mid-back, provides stability and protection to the vital organs within the chest area. Each thoracic vertebrae connects to a pair of ribs, forming part of the rib cage. The lumbar spine, or lower back, bears the majority of the body's weight and is crucial for supporting the upper body and facilitating movements such as bending backwards or forwards. And finally, the sacral spine that connects the spine to the pelvis. Each part has its own set of vertebrae and serves specific functions in supporting the body and enabling movement. For example,
that cervical curve is crucial in how the body functions to help bring this natural cervical curve back into the spine. So it really helps.
The cervical spine is crucial for overall health because it protects the brainstem, receives blood supply from the vertebral and carotid arteries, and is supported by neck muscles like the erector spinae, which aid in its movement. As reported in a 2023 medical text on the anatomy of the head and neck pain affects 10 to 30% of adults and can be acute or chronic, often resulting from trauma, arthritis, or nerve compression. One common issue in the cervical spine is lordosis, an exaggerated inward curve of the spine.
It's the natural lordosis, the natural curve. This is why we have lumbar support.
Cervical lordosis is the natural curve of the neck that helps balance the head and absorbs shock. When this curve is excessive, it can lead to cervical hyperlordosis, too much inwards or forward curve, or cervical kyphosis, an abnormal outwards or backwards curve. Causes may include poor posture, trauma, osteoporosis, or neuromuscular disorders. Symptoms of spinal nerve issues can include neck pain, stiffness, reduced movement, and in severe cases, nerve compression causing numbness or weakness in the upper extremities. Spinal nerves connect the spinal cord to the body, except for the head and the neck, which are served by cranial nerves. Still, headaches can result from cervical spine issues because joint irritation or compression can affect nearby nerves and blood vessels. In a society with prevalent poor posture and sedentary lifestyles, neck muscles are frequently strained or overworked, leading to tension headaches. Other spinal issues such as scoliosis, a sideways curve of the spine, can affect any parts of the spine, cervical, thoracic, or lumbar. But regardless of the direction of the curve, flexible spinal curves may cause less notable symptoms, whereas fixed curves often require medical intervention. Hypothetically, addressing joint restrictions might help resolve related issues.
And 3-0. Ooh! Oh my God, do you feel that energy just like flying off of you?
For instance, sciatica, characterized by pain radiating along the sciatic nerve from the lower back through the buttock and down one leg, is often caused by compression or irritation of the nerve roots. By addressing the joint restriction, you may relieve the pressure on the nerve and alleviate the symptoms. So even if the specific concept of subluxation as a distinct clinical entity is debated in evidence-based chiropractic care, and the issue may not stem from a bone or joint going out of place, if your spine is in a particular position for extended periods of time, joint irritation may result. Although disc problems such as herniated or bulging discs can occur in the spine, they are less common than issues with facet joints. However, adjustments can indirectly affect discs by creating a vacuum effect within the joint space, which may help draw fluids and nutrients into the discs, potentially improving their hydration and function. However, facet joints are often the primary focus in spinal manual therapy.
Misrepresentation or myth to believe that chiropractic treatments affect the disc, because they don't. They affect the facet joint.
Known for their sensitivity, these joints are easily irritated or inflamed due to their rich nerve supply, leading to frequent pain. In the lumbar spine, facet joint syndrome is often associated with age-related wear and tear, which can lead to joint misalignment and decreased disc height. In the cervical and thoracic regions, facet joint pain can be triggered by traumatic events such as whiplash or repetitive strain injuries. Chiropractors aim to relieve pressure by introducing movement to any restricted or stuck joints.
So we're just trying to make it move well. And when we make it move well, people generally feel better.
Spinal manual therapy involves using high velocity, low amplitude force to manipulate spinal vertebrae that are not moving or functioning correctly.
Precise force into the joints of the spine with the goal to improve the mobility and the function of those joints.
The goal is to reduce misalignment and improve mobility, and in turn relieve nerve irritability, muscle tension and spasm, and ultimately pain. But again, it is important to point out that while many chiropractors claim to correct misalignment of the spine, this is not what is actually occurring in the spine and not what is causing the patient's symptoms. Chiropractors typically use their hands and body weight to apply these high-speed forces, although they also used specialized tools.
This table just lifts up underneath her hips just like that, and we just adjust her pelvis so we start to correct. So that's just the table.
That's not her body. Wow.
So this kind of gets that spine moving.
Oh, that looks fun.
And kind of go over the areas that we adjusted.
It's like a massage.
I know, right?
But as we've discussed, the myth of chiropractors snapping your body back into alignment is just that, a myth. So what's really happening? In his video outlining evidence-based benefits of chiropractic care, Ogin explains that within the joint there are synovial folds.
It's within the joint, but kind of on the outside within the joint, right underneath the capsules that hold the joint.
In their paper, Alexandra L. Webb et al. Explained that these synovial folds adapt to the joint's contours in all positions and act as passive space fillers, filling the non-congruent parts of the joint in its neutral position, but moving when the joint is in motion.
And they think that those can fold inward and get stuck within the joint itself.
Ogin explains that when synovial folds become displaced or compressed, it can make people feel stiff, restricted, and locked up. Spinal manual therapy aims to open up the joint and relieve this obstruction. Chiropractic care can also assist in breaking up scar tissue, which consists of collagen.
That's the stuff that makes up tendons and ligaments, and collagen fibers are also abundant in the joint capsules that protect and bind joints together.
Its accumulation is part of the body's natural healing process after an injury, but it can also form gradually alongside a person's unhealthy movement habits.
People that are sedentary over a certain amount of time, and that collagen kind of condenses and it gets very stiff and restricted.
Chiropractors aim to make this collagen more flexible and dynamic. However, this aspect of care typically involves tools like massage devices and is associated with long-term improvements rather than the immediate pain relief of spinal manual therapy. Another purported benefit of the chiropractic adjustment is an improvement in blood flow.
When you have improved circulation, you have more oxygen and glucose, which help tissues heal faster.
However, scientific research specifically linking chiropractic adjustments directly to increased blood flow is limited. Yet another purported benefit of a good back cracking is this.
One of the benefits of chiropractic adjustment is you'll see an endorphin release. That's generally why people actually feel good getting adjusted.
This can provide a sense of temporary relief and well-being. While the data supporting this effect is again limited, and what is there suggests the effects being minimal, it is plausible since the nervous system is actually being stimulated. As Dr. Dekmejian points out, the experience might trigger a kind of adrenaline rush, akin to a fight or flight response.
You get full of adrenaline, you're all pumped up, your body's stimulated, your heart's racing, you're breathing faster, you're ready to go.
It is important to note that in his video, Dr. Dekmejian is critiquing viral chiropractic videos, but he brings up an important point. He notes that the sensation of relief might be more psychological than actual physical. When people undergo these dramatic adjustments, their bodies may interpret the experience as risky. The resulting sense of relief can be a reaction to the perceived danger, similar to, whew, I survived feeling.
I'm still alive.
This relief may come from a psychological shift, bringing anticipation or stress levels back to baseline, rather than a direct physical improvement in pain.
All right, bring it down. Good, and bring it up again.
This relaxation can further stimulate endorphin production. As individuals experience pain relief or reduced pain perception, they are encouraged to move more and expand their range of motion. This brief improvement in movement can boost confidence in using the spine, especially if performed in a safe, supportive environment.
Hold on, I want to hug you. Oh my God, wait a minute.
It's coming up, right?
For years I couldn't do this. Hold on for a second. Is this...
Just getting closer, right?
Oh my God, I love you already.
But the big question is it safe?
Is it safe? Is it helpful? Are they real doctors?
Chiropractor Dr. Dan Eleutheri makes a good point.
If I was terrible at what I did, it was high risk, my malpractice insurance would be through the roof, and it's actually less than my auto insurance.
And while chiropractic adjustments are relatively safe, on very rare occasions, there can be serious complications, such as herniated discs or even strokes.
A 28-year-old woman paralyzed in the ICU. The result of a neck adjustment, 4 arteries were ruptured, stroke, and cardiac arrest.
The main risk factor for stroke from neck manipulation is arterial dissection, which can occur if the adjustment causes a tear in the vertebral or carotid arteries, leading to a blood clot that may travel to the brain. Although the risk of stroke is estimated at around 1 in 100,000, a report by the Canadian Medical Association Journal suggests that such cases might be significantly underreported because the connection between neck adjustments and stroke is often overlooked. However, this data is from 2002, so it's worth examining whether advancements or more conservative approaches have emerged since then.
Taking a very strong rope, putting it around your neck, and basically hanging you, except he's not hanging them any longer than a second.
Oh wow. Maybe not. Using intense force or incorrect technique in chiropractic adjustments, especially with tools like the Y-strap, can be risky.
Breath in.
Like popping your head off.
When your skull literally pulls off your spine and it pulls the spinal cord and the brain apart from each other.
The brain stem controls vital functions such as breathing and consciousness, potentially leading to fatal outcomes. Considering these risks, my thoughts on these high-risk techniques are, well, You don't gotta be doing all that, bro.
And your head snaps forward. The whole skull goes forward and it can rip right off your spine. This guy's recreating motor vehicle accident injuries to the neck.
And now the vertebrae can't stay in place, so then they just keep going out of place, so you gotta manipulate it in place.
Dr. Hauser also suggests that muscle soreness people feel often results from muscles overcompensating for work that should be handled by the ligaments. So, while a patient might experience temporary relief, the problem could be getting worse.
There you go.
Yes! And I think that exemplifies the main concern of chiropractic adjustment as an overall practice. Is it just a scam? A money-making machine designed to keep you coming back for more?
If you go to a chiropractor and all they do is adjust you, they suck. Don't go to them anymore. It's 100%.
You're just looking to get cracked.
So you shouldn't need to see someone like me week in, week out for the rest of your life.
Unless chiropractic care addresses the root cause of the problem, including the behavioral habits and lifestyle factors that contributed to it, and includes exercises to strengthen you on the path to optimal health, it's wasting your time, keeping you dependent, and taking your money. As fitness trainers Sal DiStefano and Adam Schaefer mentioned on their Mind Pump podcast.
If you do an adjustment on somebody and they feel better, if you don't correct the reason why they're in pain in the first place, they're just going to go back to where they were before.
The adjusting part is not the bad part. It's just they need to complement that with exercises and stretches to go along with it. You know. And
the issue is not solely due to a predatory industry trying to profit. It's a complex situation. As I mentioned, spinal manipulative therapy is deeply linked with chiropractic identity, which may lead practitioners to be hesitant about exploring other methods. Additionally, they are trying to meet patient expectations. It's just like trainer Justin Andrews says.
the expectation for them is that they're going to feel good and be relieved in that instant moment and then walk out and, go about their day.
People see it on Instagram and come back into the clinic and want their back cracked. Crack my back. And with both supply and demand influencing the practice, the chiropractic industry inevitably becomes more about quantity than quality.
They break up the appointments like 8 minutes apart for the entire hour. So this person's getting in 8 people in every hour. Or two.
To fully understand a patient's needs and capabilities, it is essential to conduct a thorough assessment before proceeding with treatment.
Pop these. Pop up here.
Find out what's happening
before they touch this. Yeah. Now massage, push. But to put a thrust into that, ooh.
Rushing to see patients quickly and repeatedly just to get them in and out faster can compromise the quality of care.
All these things factor in when I'm designing a program for them that's going to get them not only their results, but also serve them long term.
It's important that chiropractors are operating responsibly in terms of both their methods and their overall intent, because chiropractors often serve as the primary contact for patients seeking treatment. Meaning, individuals can see a chiropractor without a referral from another healthcare provider.
You can do it like that, but as soon as you round, that interthecal pressure will pop that out.
At the same time, patients have a responsibility to manage their own health wisely and choose their healthcare providers carefully to avoid exploitation.
Why does it gotta be called victim blaming? Why can't it be called victim accountability?
Overall, spinal adjustments performed by chiropractors can provide benefit to a patient, primarily in reintroducing mobility back into an otherwise stiff joint. This professional-patient relationship is especially powerful for individuals with chronic conditions like low back pain, which may have limited treatment options beyond pharmaceuticals. The immediate relief provided by spinal adjustments can be particularly empowering, fostering a strong sense of trust in the chiropractor's ability to manage their pain effectively, and motivation for patients who have otherwise struggled with persistent pain.
It's really important once you start moving better to own that movement, and the only way to do that is to continue to move on your own and do exercise.
However, spinal manipulation alone does not address the underlying issues and can lead to a dependence on chiropractic care. Effective healing typically requires patient participation, usually through prescribed exercises, and any responsible chiropractor should either provide these or refer patients to appropriate specialists within a comprehensive healthcare system. Keep in mind, the healing may also include lifestyle changes so that your lifestyle reflects the body you want to have. That is, active, mobile, and flexible. That way, you won't need realigning. you'll already be aligned, bro. What's the saying? I stay ready so that I don't have to get ready. If you enjoyed the video, be sure to leave us a comment and give it a big thumbs up to feed the algorithm. And if you're already subscribed to the channel, make sure that YouTube didn't unsubscribe you. We are now on our way to over 700,000 subs, so we don't want to lose any of you interns along the way. If you didn't like the video, and chiropractic fanboys, I'm talking to you, be sure to let me know why in the comment section down below. I read as many comments as I can, and we use your feedback to make our videos better for you, even the fanboys. And don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better, prevent injury, and learn to look after your back by yourself. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, treat one.